So let's talk about vaping. With multiple deaths and hundreds of cases of a mysterious lung disease, many people have questions and are concerned with the growing trend of vaping. So what does an ER doctor and mom of a teen need you to know about vaping? Let's find out with Dr. Deb Green, Associate Chair, Emergency Department at Emerson Hospital. This is HealthWorks Here, the podcast from Emerson Hospital. I'm Bill Klaproff. Dr. Green, we know why vaping has been in the news lately with many horrific stories of lung disease and even death. So what is it about vaping that makes it potentially dangerous and harmful?
Well, I think this is a multi-layered question. So essentially, we've known for a long time that nicotine is a really powerful and addictive drug. And so vaping, from a public health perspective, is the new look of nicotine addiction. Nicotine is highly addictive and has some really serious ramifications for youth and young adult use. It's highly addictive. It causes changes in brain development, and users are really at risk for permanent brain changes, changes in their brain that control in attention and learning and mood development of mood disorders and permanent lowering of impulse control. And we know that kids who use electronic cigarettes and vape are 4 times more likely to go on to use, sort of more combustible traditional tobacco products, as well as, other drugs like opioids and cocaine.
It's almost like a gateway then to smoking when it was originally designed to help people quit smoking.
It really is. The Surgeon General has actually called these sort of flavored products starter products that help establish smoking products or smoking habits in young adults that lead to long-term addiction. So it's really, this surge in youth vaping really threatens to undo decades of tobacco reduction efforts and really exposes a whole new generation to nicotine addiction, because we know the earlier people start using nicotine, the harder it is to quit.
Yeah, that's really interesting what you're saying. So basically, vaping cuts out the tobacco in the smoke, which is horrible for the lungs, but still includes the nicotine, and that's what's so addictive.
Exactly, yeah. So, it is true that these, products don't expose the user to, the cigarette smoke with tar and carbon monoxide and the oxidant gases that damage the lung cells, but a safer thing does not actually mean it's truly safe, and I think that's what's important for people to keep in mind.
Yeah, is that the message for parents then? What should parents know about vaping? It sounds like that's the message. This is really not safe and often leads to tobacco use?
Yes. We, for one thing, the teenagers may not even really realize they're vaping nicotine. These products are not well labeled. There's no sort of regulation on product design or safety or labeling. So a lot of kids may not even realize that they're actually ingesting nicotine. There was a study of youth or teenage users of the Juul product, and almost 2/3 of them didn't realize that they were actually vaping nicotine. So, and a lot of studies that have looked at the nicotine-free products actually still contain nicotine. So I think, parents should be aware, try to educate your kids that these products do contain nicotine, and it can have definitely lifelong health consequences, changes in their brain development, and certainly puts them at risk for this new vaping product-associated lung illness that, we're seeing across the country. So it's extremely alarming.
It is alarming. So I would imagine part of the problem, my kids are older, so I don't have to worry about this anymore. But I would imagine part of the problem, Dr. Green, is with vaping, you don't reek of smoke when you come in the house. So how can a parent tell if their child is vaping?
Yeah, so this is a challenge. There really isn't that telltale odor of tobacco or marijuana. I mean, people may only notice sort of a sweet scent or sort of a fruity odor. So I would be, sort of looking for that. The devices that the kids are using are very small, they're compact, they're easily concealed. This is why, teachers in schools are having such a tough time. The kids can put it in their, pocket of their sweatshirt and zip off to the bathroom. So I would, have parents, really, keep an eye out for sort of unfamiliar products, unusual or odd looking pens or batteries or USB devices. And then, on another level, we know that regular vaping does dry out the nasal passages. It dries out the oral mucosal passages. So sometimes people present with nosebleeds, recurrent nosebleeds, because their nasal passages have dried out. Sometimes people are noticed to be sort of continually drinking liquids because their mouth feels so dry after vaping. And then there's sort of this other phenomenon called vapor's tongue, where sort of regular vaping causes a sort of diminished ability to taste. And so you may see your teenager sort of, reaching for the salt shaker at the dinner table or choosing unusually spicy foods or something like that. But, I think that the challenge is really that it's so hard to detect. I mean, kids have been known to vape in class and get away with it. So I think it's really hard for parents.
Yeah, what you described, it sounds really tough, and I've never heard of vapor's tongue, but what you have just described is really important and useful. So thank you for that, Dr. Green. So what should a parent do then if they recognize some of these signs of vaping?
It's really important to get yourself educated. You really need to get the facts. And there's some really great websites out there. The one I like is ecigarettes.surgeongeneral.gov, and that has really good information for parents, a whole tip sheet for parents on how to talk to kids and sort of resources and sort of how to take it from there. But I think get yourself educated and just, you really have to talk to kids, and the kids themselves may not really know what they're ingesting and what they're using. I mean, these are a generation of kids that would probably, abhor the thought of touching a tobacco cigarette because it's been ingrained on them since kindergarten that cigarettes are bad. But they really may not know. So I think it's important to really talk to them like, look, this is what you're using. This can cause changes in your brain. But also, I think it's important to talk to kids where it might most matter to them. Say, look, this may be impacting your athletic ability. I've heard anecdotal evidence that coaches notice decreased stamina in some of their players. You can talk to kids, look, this is going to impact your finances. Your after-school job money is all going to these products, and you're going to need more and more of them to feed your addiction. And also just, to let them know, look, a lot of these companies are owned by Big Tobacco, and Big Tobacco has a long history of prioritizing sales over safety. And, they are luring you guys in and with Instagrammers and influencers and making this product really cool and cheap and sweet and really easily obtained. And so kids are really being played. And I think kids don't want to feel like they're being made fools of. And so I think that may be the way to approach kids.
Those are all really good points to remember. So what if your child is vaping and they get sick? What are the signs of a vaping-related illness that needs medical attention?
I think some symptoms may be fairly mild. Kids may just complain of a cough or feel tired or, may be having nausea or vomiting. But I think if kids are feeling short of breath or they're complaining of chest pain, severe abdominal pain seems to be a component to it. I think that's a time to seek medical attention. Unfortunately, a lot of these symptoms overlap with influenza symptoms, and so it can be really, really challenging to tell. So I think it'll be an interesting winter, for sure.
Yeah, that's for sure. So Dr. Green, you're a mom of a teen, so you have firsthand experience with this. It sounds like the same message that we tell our kids that smoking tobacco, smoking cigarettes is bad. The best prevention is to not start in the first place. That sounds like the same message really applies to vaping as well. Is that right?
Absolutely. Don't start. It's harder to quit if you start early.
That really is the message. Dr. Green, thanks so much for your time today.
Oh, you're very welcome. It's my pleasure.
That's Dr. Deb Green, Associate Chair, Emergency Department at Emerson Hospital. And for more information, please visit emersonhospital.org. And if you like what you've heard, please share it on your social channels and be sure to check out the full podcast library for topics of interest to you. This is HealthWorks here from Emerson Hospital. Thanks for listening.